Take us inside your hospital system. What are you seeing when it comes to Omicron and COVID?
We feel we peaked about a week ago. It's pretty flat right now, but we're still seeing a fair number of infections per day. Fortunately for us, despite the fact that we've had more than the last surge in the winter with Delta virus of last year, less patients requiring ICU care and less patients requiring ventilator care. About 50% of our patients are unvaccinated and 50% are vaccinated, almost all of them double vaccinated as opposed to getting the booster. And it's the elderly, immunocompromised, and unvaccinated that comprise the ICUs in our system. So getting boosted is a big help.
So getting boosted is not a guarantee, but it's likely to keep you out of the hospital. Of the people who are coming to the hospital, how many of those people are coming in for COVID and how many are coming in for something else, and then you test them and you find out they have COVID?
That varies over time. A few weeks ago, it was about 50% with COVID, 50% for COVID. Now it's pretty much people coming in for COVID. It's about 80-20. And last year during the Delta surge, it was 90% for COVID, 10% with COVID. So it's fluctuated some. Look, this is a very, very infectious variant. It's ubiquitous. A lot of people are getting it. I am sure that the positivity rate is higher because a lot of people aren't reporting it. A lot of people don't have access to testing. So we need to be very careful. And that's why the government handed out the N95 masks, which are protective.
At New-York-Presbyterian, is it changing what you can do in this sense? Are you having to forego some elective surgeries, some other things you would be doing because of the demands from COVID?
If we could delay something appropriately, yes, we've delayed that. We've shut down about 25 to 30% of our operating room capacity to make the capacity for COVID. But there are a lot of cases coming in that are quote unquote elective that really need to be done. Whether it's a heart case, whether it's a neurosurgical case, whether it's a cancer case. So we have been able, thank God, to be able to deliver the care required by the community as well as the COVID care. But if you had an elective knee surgery operation or you're a young person who needs a hip replaced and can wait, we've asked people to wait.
Give us a sense of what it's doing with your staff. I know it's been an enormous burden on hospitals like yours. How are your doctors, how are your nurses, your other healthcare professionals, how are they holding up?
They're holding up well, but look, this is the third surge. People would have hoped that we were over it after surge 1 and then surge 2 last winter. And with the vaccine, I think people were really, really hoping that this wouldn't happen. So you have that. That being said, everyone has really bucked up and done a tremendous job. But you have to remember, you've had the great resignation, as you've reported on, David. You have a lot of people leaving healthcare. You have a lot of people who've gotten sick with this variant. We have really struggled with staffing, trying to hire traveling nurses, outside nurses. We are recruiting at a breakneck pace to get new graduate nurses and others into the institution. So it's been a big strain on the staff.
Stephen, at this point, can you have any sense of whether this might have longer-term repercussions for your ability to attract and retain some of the healthcare professionals you need?
I don't think so. I think that people really do want to go into healthcare. I think that they understand the importance of it. They understand how much the healthcare system has really helped the country get through this. I think we've gone through that wave of the resignation. I think people really do want to go into healthcare. I don't think there'll be a long-term effect, but boy, oh boy, it's been tough over the past couple of years. And I don't want to cry crocodile tears. It's been really, really tough on the frontline staff.
You warned us that there could well be another wave and there could be a variant. I'm not sure we were fully prepared for it. Maybe even at the governmental level, we weren't fully prepared. Let's assume for the moment there's another one after this. We don't know that there will be, but I don't think we can rule it out. What should we be doing right now to prepare for the next wave?
You and I have spoken about this, David. You have to take a just-in-case mentality as opposed to just-in-time. We purchased an entirely new warehouse right during the first wave in 2020. So we have adequate supplies of PPE. We have adequate supplies of just about everything, with the exception of some of the supply chain shortages that you see throughout the rest of the economy. But Testing is really important. Getting the tests out to Americans is important. The masks are important. Making sure that that we are continuing to discuss with the pharmaceutical companies another vaccine or a booster for the next variant. We don't know. We can't predict what's going to happen, but assuming the worst, usually, and hoping for the best is probably a better strategy than waiting to react to a problem. I think the testing problem really exacerbated this, to be honest with you.
Well, let's pursue that specifically, because the government right now is in the process of mailing out a lot of free tests around the country. I don't know that we were fully prepared for this. What should the government, because I'm not sure that New-York-Presbyterian can take on this problem for New York, but what should the government do in terms of stockpiling for the next one, these rapid tests?
Well, they should. The short answer is I don't know what they're doing to stockpile, but they ought to. My wife and I went on the website yesterday. It's very easy to order a test. And I think the government purchasing more and more of these tests is going to be critically important. Look, the antigen tests are not the be-all, end-all, but it helps. It helps to know if you're positive. And although we've had the debates around the country around masking, an N95 mask is pretty darn protective. And we see that in the institution. When our staff have the N95 masks on and they have their visors on, they're not getting infected in the hospital. They're getting infected in the community. So we know that these masks are effective. Stockpile the masks, stockpile the tests, make sure we have an adequate stockpile of ventilators. God forbid we have another serious variant. Make sure that the strategic stockpile is really well equipped to deal with the next pandemic. There will be another pandemic. When? Who knows? Will there be another wave of COVID? I don't know, but I wouldn't bet against it.